isolation beds nationally. And this done in 6 months. These achievements are indeed phenomenal. And through you, Governor Oparanya, Chair of Council of Governors, I take this opportunity to thank you for the partnership that you and your governors have shown during this very difficult period of time. In fact, in this period of 6 months, we have actually installed more medical equipment than has ever happened since our country's independence. As an affirmation of our expanding capacity, and as we continue to use this moment to reimagine Kenya's healthcare, earlier this month, I presided over the official opening of our 5th National Referral Hospital, the KU Teaching Referral and Research Hospital. The new facility is part of our national response for specialized treatment of chronic diseases, notably cancer and renal diseases, twin diseases that have caused and wreaked havoc to many families across the nation. In that regard, once the KU Integrated Molecular Imaging Center is completed by March of next year, there will no longer be need for any Kenyan to travel abroad in search for specialized treatment, cancer treatment, as our enhanced capacity will be able to handle any medical conditions that people now are currently traveling abroad for. Indeed, the referral facilities, coupled with the expanding county infrastructure, will enhance our national possibilities and anchor our plans to position our nation as a top medical hub for our region, for the continent, and indeed develop medical tourism as a new area of generating income and jobs for our people. This will also help us with our national rollout for the universal health care under the Big Four agenda. So fellow Kenyans, our expanded health infrastructure, as I've just mentioned, is indeed impressive. However, it is important to question ourselves and ask ourselves, does it make our position unassailable if a second wave were to hit us? Is it sufficient a buffer to keep a second wave at bay? The answer to this question is a resounding no. The expanded infrastructure is necessary, but still not sufficient. Without citizen action, the impressive infrastructure cannot forestall the aggression of a second wave, as I said, as we have seen in other countries. So to buffer the country, therefore, the citizens must, as they have been, position themselves as the first line of defense. The reason why we have managed to flatten the curve is because Kenyans have exercised an impressive civic responsibility and duty. And if danger is most present in moments of victory, this achievement is in danger if we do not watch out. And that is why I urge all Kenyans to double their efforts in observing the COVID protocols. We have got this far because we, the citizens, were the first line of defense against the pandemic. And as we get into the next phase of the war against this pandemic, we must heed the teachings of St. Francis of Assisi, who said, and I quote, "Start by doing what is necessary, then it will lead you to what is possible, and before you know it, you will find yourself doing the impossible." End of quote. If we do what is necessary during the next phase of the war against the pandemic, it will lead us to do what is possible. Then cumulatively, our necessary actions, like wearing masks, coupled with our possible deeds, will lead us impossible outcome of containing this pandemic. Indeed, as a people, we must always remember that impossible is nothing if each and every one of us applies themselves. So therefore, in the spirit of co-creating the new normal between the government and its people, and on the advice of the National Security Council, and in line with the recommendations of the National Emergency Committee on the coronavirus pandemic, I direct and announce as follows. 1. That the nationwide curfew enforced throughout the territory of the Republic of Kenya is extended for a further 60 days. 2. That the commencement time for the nationwide curfew is varied from 9 p.m. to 11 p.m. Therefore, effective tomorrow, Tuesday, the 29th of September 2020, the nationwide dusk to dawn curfew will run from 11 o'clock at night to 4 o'clock in the morning. 3. That the prohibition against the operation of bars and the prohibition against the sale of alcoholic drinks and beverages by ordinary restaurants and eateries shall stand vacated with effect from the 29th of September 2020. Unaweza kunywa pombe, sawa. 4. That the closing time for all bars and restaurants and eateries shall be 10 p.m. every day with effect from the 29th of September 2020, and their operations shall be with strict adherence to the applicable guidelines and protocols issued by the Ministry of Health. 5. That in line with the recommendations of the Interfaith Council, the permitted maximum size of religious gatherings is increased to 1/3 of its normal sitting capacity, but with strict adherence to all applicable guidelines and protocols issued by the Ministry of Health. 6. That the permitted maximum number of persons attending funerals and weddings is reviewed upwards from 100 to 200, but with strict adherence to all applicable guidelines and protocols issued by the Ministry of Health. And indeed, once again, going back to the Honorable Musalia Mudavadi, he posed a question. We thank Kenyans, but it is we, the political class especially, that is leading the charge in defying laid down protocol. So hii ugonjwa ikiendelea kusambaza, tujiangalie sisi wenyewe mbele ya tuanze kuangalia wananchi. Hiyo nimesema 200, good. As we progressively de-escalate the containment measures and resume a sense of normalcy, on education, our paramount consideration, both as a government, but also as parents, is the safety and well-being of our children. The lives of our children and their health is not a matter for debate. Learning institutions, therefore, should only be reopened when we have and can sufficiently guarantee the safety of all our children. And here, I really would plead with Kenyans, let us not focus ourselves on when schools will reopen, but how shall these schools open in a manner that protects our children and protects their lives and their health. Tafadhali, tusiwe tunapigana juu ya mambo ambaye, let us think first about their health and well-being, and once we have established how, then together we will agree when. So therefore, the resumption of in-person learning must be predicated on strict adherence to the health protocols and guidelines as issued by the Ministry of Health. So therefore, I call upon the Cabinet Secretary for Education, once we have agreed on the how, he will thereafter immediately issue a calendar for the resumption of the 2020 academic year, if it is to be, or if it is going to be 2021. Hiyo ni kulingana na directives na vile tutakubaliana hao. As I give these directives, I underscore the need to continue adhering to the health guidelines and protocols to avoid losing the gains we have made thus far. And that I will not hesitate to escalate containment measures in the event that any of these indicators that we know start to rise again. So fellow Kenyans, and conference participants, the containment measures put in place in March of 2020 to stem the spread of COVID-19 have had positive returns in terms of our safety and national security. This is something most people have not actually noted. In the 6 months since we started the containment measures, crime has exhibited a 21% average decline and traffic accidents have reduced by an average of 10%. So with that, I want to conclude with some thoughts for all of us. As I said, especially with regard to our economy, and as I said earlier, that we are living in a season of paradox, an age where our new reality is a conflict with what we feel reality should be. Indeed, that is not only true of our social lives, but also true of our economy. Against all odds, as we have seen and heard today, some of our entrepreneurs have remanaged and reimagined the subsisting pandemic and created a new business reality that disorganizes the existing order at play. This is a new business model driven by innovators and makers of things. People who did not see danger in the COVID crisis, but actually saw an opportunity. Businesses that experienced shock from COVID, but bounced back better. But the question that this development begs is the following. If positive disruptions and innovations have mushroomed during COVID-19, how do we together support them as part of our resilience building strategy? How do we boost a small samosa delivery company known as Wow Eats, whose recipe is hundreds of years old, for instance? How do we encourage the Association of Women in Agriculture with their innovative work, especially amongst vulnerable, informal settlement women across the country? How do we assist this kind of people? During the first phase of this pandemic, we rolled out a series of economic stimulus packages, and today, in support of our small businesses and innovators, I also direct as follows. One, that the National Treasury considers retaining the VAT at 14% until the 1st of July 2021. Two, that the National Treasury considers retaining the income tax rate, pay as you earn, at 25% until the 1st of January 2021. Three, that the National Treasury considers retaining the resident income tax, which is corporate tax, at 25% until the 1st of January 2021. And four, that to continue cushioning low-income earners, the National Treasury maintains the 100% tax relief for persons earning a gross monthly income